Jaundice is a severe condition that is common in children, mostly 2 to 3 days after birth. It usually happens when a yellowish discoloration appears on the white part of the eye, the mouth and even the body. The jaundice condition can either be mild, moderate or severe. Whilst the mild cases of jaundice usually resolve by itself, even without medications, the moderate and severe cases should be handled with care before it creates complications. The head of Department for Pediatrics at the University for Development Studies School of Medicine, Professor Al-Hassan Abdul Momin, highlights the cause factors of the jaundice condition.
For the risk factors themselves, identifying them early allows you to put in precautions. So in that case, if you identify that this baby is at a high risk of developing severe jaundice, you will not discharge them from the hospital immediately after birth, because there are times that they discharge babies at 6 hours or even at 24 hours because the baby doesn't have any problem. But if we know that this baby has a high risk or is in the high risk category, as in they have the mother has GCPD deficiency, the mother is blood group O positive, or the mother is rhesus negative blood group, or the mother has ever had another baby that developed jaundice requiring them to treat that baby in the hospital, then you would want to keep this one in the hospital for a longer period. So for most of the time, for jaundice, we prefer to take the precautions so that they don't develop the jaundice, or if they develop it, we'll pick it up much early and treat than waiting until it becomes so severe. But if we do identify that the babies themselves have jaundice, then that is very treatable. We can treat it.
He says the use of concoctions by mothers and other substances on the baby also has a high risk of giving the child jaundice and advise mothers to avoid seeing.
There are some mothers who may take things that are not prescribed, especially herbal concoctions, herbal substances. If they do that, they are likely to have a risk of giving birth to babies that have more severe jaundice. And our people like putting substances around babies. So for instance, there is this substance that we call camphor. Camphor, many people when they wash the clothes of their babies, they actually will put the camphor around the clothes. The aim is to drive away ants and insects, but that one actually can also cause jaundice in the newborn. So these are some of the risk factors that may be related to the mother.
Professor Momin encourages regular antenatal care in order to detect early and any possibility of jaundice.
Pregnant women, as I said, we have talked about all the risk factors. Some of them are from the mother. And if you are able to attend antenatal clinic early and then attend it at a place where they are able to screen for the risk factors, then they will detect each of the risk factors that you may have. Either your blood is not compatible with your husband, either you have the enzyme defect we mentioned earlier on, the GCPD defect, either you have had another baby who was already jaundiced earlier on. So if they find you in these categories, we actually will monitor you more different from the way we will monitor all other pregnant women. And when you deliver, we will keep you probably longer in a hospital to make sure that your baby does not develop severe jaundice.
Some mothers whose baby have been diagnosed of jaundice share their feelings after realizing their babies have the condition.
So it was not that easy because this is my first time, but I was able to manage it. Like I think when you see it for the first time, you should try and report to any nearby clinic, or if you have a doctor or nurse around, and you should complain it too. Because actually when we went to the NICU, they were like that kind of disease, or I should say it's a disease, right? Illness. And they said it can affect the child later. When it happens like that and you didn't report to the doctor and they take care of it earlier, that it might affect the child later. So I'll encourage all mothers that they should try, anytime that you see something like that on your baby eyes, you should try and report to your doctor so that they will take a look at it.
After the birth, it was after the birth that we realized the eyes was changing to yellow. So they asked us to send him back to the hospital. So when we went, they said we should do the lab test. So after a lab test, they realized it was jaundice. They admitted and they said they are going to put him under phototherapy. So we were under the phototherapy at West Hospital. So on Thursday, it was generalized out in Tamale. So their machine got affected. So they transfer us to TTH to continue with the treatment.